So lymphomas, as their name indicate, are disorders that are caused by malignant proliferation of lymphocytes. These accumulate in the lymph nodes, causing lymphadenopathy. But these lymphocytes, they may also be found in peripheral blood or infiltrate organs. Lymphomas are histologically divided into two categories. One is Hodgkin lymphoma, and the second type is non-Hodgkin lymphoma. So lymphoma is basically, you can say, a tumor of or malignant proliferation of lymphocytes. There are two types of lymphoma, Hodgkin lymphoma and non-Hodgkin lymphoma. Hodgkin lymphoma is this is basically a histological division. So if the lymphoma is associated with Reed-Sternberg cells, what are Reed-Sternberg cells? They are large and abnormal lymphocytes with, or you can say, large multinucleated lymphocytes. So you can see in this diagram that this is a normal lymphocyte and this is a large lymphocytes which contain 1, 2, and 3 nuclei. So this is called a red Sternberg cell. So if red Sternberg cells are present on a lymph node biopsy, then it is a Hodgkin lymphoma. Otherwise, it is a non-Hodgkin lymphoma. In Plab1 exam, they usually won't ask you to differentiate between Hodgkin and non-Hodgkin lymphoma. But still, you need to remember this Reed-Sternberg cells. If they mention this Reed-Sternberg cells and Hodgkin and non-Hodgkin both are given in the option, then you will choose Hodgkin lymphoma. So how patient with lymphoma can present to you? Lymphadenopathy plus splenomegaly plus weight loss plus B symptoms. So someone with lymphadenopathy and splenomegaly and B symptoms. What are B symptoms? B symptoms are unintended weight loss, unexplained fever, and night sweats. So lymphadenopathy with splenomegaly. With weight loss, unexplained fever, and night sweats, you will suspect lymphoma. We have already discussed that there are two types of lymphoma, Hodgkin lymphoma and non-Hodgkin lymphoma. Hodgkin lymphoma has a bimodal age of presentation, that it is common in patient with less than 25 years old and common in patient above 55 years old. Usually there will be painless and rubbery, slowly growing peripheral lymphadenopathy. This is the commonest presentation of a lymphoma. So someone with lymphadenopathy, you will suspect lymphoma. You will keep lymphoma in your differential diagnosis. The other symptoms that can be present are fever, weight loss, and night sweats. Remember that tuberculosis can also present with these features. That is lymphadenopathy, mostly cervical lymphadenopathy, weight loss, fever, night sweats. But again, in tuberculosis, there will be history of cough with sputum or hemoptysis, and there will be history of travel to areas such as Africa or India. And in tuberculosis, the lymphadenopathy is initially painful, and in later stages it becomes painless. While in a lymphoma, the lymphadenopathy is painless from the beginning, and it stays painless throughout. These lymphocytes, they can invade the bone marrow, and that's why pancytopenia is usually present in patient with lymphoma. That's the reason that the person is having some B symptoms such as weight loss, unexplained fever, and night sweats due to pancytopenia or neutropenia. and infections, etc. The diagnosis is confirmed on excisional biopsy of the lymph node. Excisional biopsy of the lymph node will show specific findings of Hodgkin lymphoma, that is, red Sternberg cells. So, example one, a 19-year-old male presents with painless neck lump that is enlarging in size. He says that he has been told that he is getting thinner. He also says that someone with a history of painless lump in the neck that is slowly growing in size. So you can see that we have seen lymphadenopathy in leukemias as well, but there was no mention of enlarging of the size of this lymph node. In lymphoma, you can see that the cervical lymph node, they are enlarging, they are slowly growing. He also says that he feels tired, fatigued, and suffer from night sweats. He denies any recent history of travel abroad. So he denies any recent history of travel abroad. So our differential diagnosis of tuberculosis is ruled out. His spleen is enlarged and temperature is 38.3. So this person presentation is lymphadenopathy with weight loss. So lymphadenopathy with B symptoms, weight loss, night sweats, and fever. You will suspect lymphoma. The most likely diagnosis is Hodgkin lymphoma, and the most appropriate investigation is excisional biopsy. Painless lymphadenopathy plus B symptom plus minus splenomegaly, think of lymphoma. Another example, a 20-year-old female has returned from New York City to the UK. 3 weeks later, she presents with drenching night sweats and fever. On examination, there are enlarged non-tender cervical lymph nodes. So you can see that uh, this patient has a history of travel, but the history of travel is to New York City and not to Africa or any other country such as India. So still not TB, though there is a history of travel. And there is lymphadenopathy with B symptoms such as fever and night sweats. So again, it's a lymphoma. The diagnosis will be confirmed, or the most appropriate investigation will be excisional biopsy. Do not get tricked by the history of travel. New York is not a prone area for tuberculosis. Tuberculosis prone areas include South Asia, such as India and Africa. Points that will favor TB in these kind of scenarios, they include history of travel from South Asia or Africa, and the lymph nodes will be initially tender, and there will be chronic cough plus hemoptysis, and sometimes erythema nodule, that is nodules, painful nodules on shins of leg. Other risk factors for TB, they include homeless persons, drug abusers, smokers, and low socioeconomic class. Remember that another disease, that is toxoplasmosis, it can also present with splenomegaly and cervical lymphadenopathy, but weight loss is not usually seen in toxoplasmosis. So lymphadenopathy with splenomegaly without weight loss is toxoplasmosis. And if there is weight loss, then it is lymphoma. And if there is a history of travel, then it will be TB. So keep in mind these three differential diagnoses. A 50-year-old male, another example, a 50-year-old male with HIV infection presents with painless peripheral lymphadenopathy, night sweats. So painless peripheral and lymphadenopathy, night sweats, weight loss, fever, and splenomegaly. What is the most likely diagnosis? So, who will tell me the diagnosis in this scenario?
HIV infection can be TB,
TB?
lymphoma.
The lymph nodes are painless, so
Yes, lymph nodes are painless.
it is lymphoma, Hodgkin lymphoma.
Yes, lymph nodes are painless, and also there is no history of cough or hemoptysis.
So
Though
patient,
extrapulmonary TB can present without cough and fever, but you can see that the lymphadenopathy is painless. So it's a lymphoma. Now the next question is it a Hodgkin lymphoma or it is a non-Hodgkin lymphoma? Remember that non-Hodgkin lymphoma is common in patients with HIV. So if you see a patient with HIV with a diagnosis of lymphoma and they give you both Hodgkin lymphoma and non-Hodgkin lymphoma in the options, then you will select non-Hodgkin lymphoma. So a specific point for the diagnosis of non-Hodgkin lymphoma is lymphoma in HIV patients. And lymphoma with red Sternberg cell will be Hodgkin lymphoma. So remember these two specific points for both of them because sometimes in the answers both of them will be given and you have to select one. So the most common HIV related lymphoma is non-Hodgkin lymphoma, and the type of non-Hodgkin lymphoma that is common in patient with HIV is diffuse large B cell non-Hodgkin lymphoma, followed by Burkitt's lymphoma. Diffuse large B cell lymphoma and Burkitt's lymphoma, they are a type of non-Hodgkin lymphomas. The diagnostic test in lymphoma, we have already discussed that lymph node biopsy, excisional biopsy of the lymph nodes. Now, how to stage lymphomas? This is just for your knowledge. If the
so
lymphoma is yes,
this mm, the HIV related non-Hodgkin lymphoma, is it like a diffuse large B cell, or it is a Burkitt's lymphoma? Are they two different?
yes, there are two different types of non-Hodgkin lymphoma, but they will not ask you to differentiate it between them. You will just have to simply select non-Hodgkin lymphoma.
Right. Sometimes in the option they give Burkitt's lymphoma as well. So in that case, which one to pick first, like non-Hodgkin?
No, Burkitt lymphoma will not be given with non-Hodgkin lymphomas.
Right.
Either Burkitt lymphoma will be given or non-Hodgkin lymphoma will be given.
Right. So it's a different from non-Hodgkin lymphoma, the Burkitt's lymphoma.
No, it's a type of non-Hodgkin lymphoma.
Right.
So non-Hodgkin lymphoma, they contain large B cells lymphoma, Burkitt lymphomas. So the
Oh,
findings will be same, lymphadenopathy and B symptoms.
okay. All right.
So some points about staging of lymphomas. This is just for your knowledge. If lymphoma is confined to single lymph node region, then it is stage 1. If it involves two or more nodal areas, then it is stage 2. If it's present on both sides of the diaphragm, then it's stage 3. And if it's spread to extra nodal sites such as liver and bone marrow, then it is a stage 4 lymphoma. In lymphoma, bone marrow is frequently involved, and that's why there may be they may be associated with pancytopenia, that is anemia, infection, and bleeding. So common non-Hodgkin lymphoma, they include, so follicular lymphoma is also a type of non-Hodgkin lymphoma. Diffuse large B cell lymphoma, this is also a type of non-Hodgkin lymphoma. Burkitt lymphoma is also a non-Hodgkin lymphoma. So these are some examples of these follicular diffuse large B cells and Burkitt lymphoma. This is a histological difference basically. In non-Hodgkin lymphoma, no Reed Steinberg cell will be present. Extranodal presentation is more common in non-Hodgkin lymphoma, such as bone marrow infiltration, which lead to pancytopenia. So this was all about lymphoma and its diagnosis.